Thanks again to everybody who's been part of this show for us for the past few months. I think in many ways we considered this to be one of the most important initiatives we pursued given the state of play just generally economically as we were going through that second surge. And I want to reiterate the comments that Senator Kennedy made about the creation of that particular program, which made it possible for us to funnel additional federal resources into it and expand it in a big way to support a lot of businesses in Massachusetts that just didn't have access to other federal programs or other alternatives. And I've heard from many of them that it was in fact the thing that got them through the surge, and we can't wait to see you in full bloom at some point later on this year. So thank you. Questions?
Governor, you described this as the final round of grants. How final is final, and what support will businesses need post the middle of summer when you hope things get better?
There's probably always going to be some trickle going on with respect to the resources there, but I think for all intents and purposes, the big bolus of this program has been distributed at this point in time, and it was designed when it was developed in conjunction with the legislature to deal with the second surge, and we're clearly past the second surge at this point. There are significant opportunities for reopening coming in the middle of May. There are significant opportunities coming at the end of May, and as both the Lieutenant Governor and I said, we expect that by the time we get to the middle of summer, we'll be in a very different place. The hospital count for COVID cases went below 500 for the first time since October yesterday, right? We're down to 485 plus or minus. The positive percent on testing went to 1.5%. There's a lot of very positive stuff going on here. I think the thing we're going to want to do is work with our colleagues in local government and with our colleagues in business to make sure that we put both the state resources that are available, and kudos to the legislature for passing a very significant economic development bill at the end of the last session, but to make sure we put not just the state resources but also the federal resources that are being made available to local governments and to the state to work in a positive way, recognizing and understanding that post-pandemic everything probably won't be exactly the way it was pre-pandemic. We're currently working on a future of work study that should be done at some point in the next 4 to 5 weeks would be my guess, to help make sure that as we go forward we're doing things that lean into the parts of the recovery that are sort of going to be the way life is post-pandemic, and at the same time, if we can mitigate and work with locals to mitigate on what some of the issues might be that are negative, that we do that as well. But I think that's going to have consequences for childcare, transportation, downtown development, and especially kind of how people think about streetscapes generally if in fact we're going to see significant reduction in so-called commuter traffic. What does that mean about walkable boulevards, bicycle opportunities, the whole shared street, shared space model that we used for the first time when we put those programs in place last summer? We're going to have a lot of work to do.
Governor, I know you get a lot of questions about reopening and possibly moving up that date. You're saying midsummer. We're hearing New York, New Jersey, Connecticut saying May 19th for events and fireworks. At the same time, everyone here is canceling fireworks for July 4th. I mean, when could we possibly hear about dates being moved up?
We're gonna play this game based on our data and our information, and other states will do what other states will do. One of the things I'm most proud of is the fact that throughout the course of this second surge, Massachusetts had one of the lowest positive case counts in the country, and we also had among the very lowest hospitalization rates in the country. The numbers were big and they were scary, but they were nothing like they were in many other parts of the country. And that meant that a hospital system that had been deeply challenged in other parts of the country and here in the Commonwealth throughout the spring and the summer, where literally across the United States, millions of people put off necessary procedures to deal with the fact that their hospitals were filled with COVID patients that they needed to take care of right away. We did not have the same kind of triage going on here in Massachusetts that was going on in many other places. And like I said, we're going to continue to play this game based on what we think makes the most sense for the people in Massachusetts. We're going to balance the economic stuff with the public health data, and if we see significant improvements in our data over the course of the next month or so, we'll make adjustments.
Should we already start canceling things like July 4th fireworks stuff?
People have to make whatever decision makes the most sense for them.
Are you concerned that we might be getting away from testing? Back in February, we were averaging 95,000 tests a day. As of this week, we were the 7-day average is 53,000. You've often said testing is very the key item in the toolbox. Are we stepping away from that, and is there a danger to that?
I think it's less about stepping away from testing and more just the fact that as more and more people have gotten vaccinated, fewer and fewer people are as worried about catching COVID as they might have been before. I think our drop-off on testing, which you're speaking to, comes a lot later than it did in many other parts of the country. If you go back 6 weeks or so ago, we were still testing somewhere in the general vicinity of where we were testing all the way through the fall and into January, somewhere between 85,000 and 95,000 tests a day. Across the country, we've gone from about 1.8 million tests a day down to about 1.1, and it's dropped down significantly since then as well. I think part of the issue around testing is as more and more people get vaccinated, fewer and fewer people are as concerned about getting testing as they might have been before. I think testing remains critically important, and we've made decisions to maintain a lot of our free testing sites and our free testing partners here in Massachusetts, at least throughout the month of June and into July, and we'll see where we are at that point in time. But testing has always been a big part of our surveillance program, and it's important for two reasons. Number one, it does give us a day-to-day sense about what's going on with respect to the virus in our Commonwealth generally, but it also can provide people with a certain level of comfort. You know, we have 180 school districts that are participating in our surveillance testing program that we're paying for and that schools are using across the Commonwealth. And there was a lot of concern about people going back to school. What was that going to mean with respect to COVID cases? And the good news there is the positive test rate across 180 districts and hundreds of thousands of daily tests that have been going on since that program rolled out a few weeks ago is less than 1%. And that can certainly provide people with confidence and comfort that school is, in fact, a safe place for adults and kids to be.
Governor, on kids, any plans to lift restrictions for them? There's a letter that was just sent to you by a group talking about they still have to wear their masks at recess, during youth sports, and they still can't share toys, even though they claim the evidence doesn't show that's leading to transmission. Your thoughts on that?
I haven't seen the letter, but obviously we check out the stuff we get from folks pretty regularly, and we have made adjustments all the way through this program in both directions, up and down, depending upon what we were hearing from people who were dealing with it on the ground.
Gotcha, but masks at recess and youth sports, do you see that continuing as the data improves? Or?
Can I read the letter before I answer the question? I haven't seen the letter. Yeah.
I mean, we've done stories about that before the letter, just about they feel like they shouldn't have to. Is that something that the group is looking at, or what's the status?
So since the beginning of this, on almost every decision we've made on anything at any point in time, there were some people who thought we were going too fast and some people who thought we were going too slow, in both directions. We weren't going fast enough to close stuff down. We weren't going fast enough to open stuff up. That's kind of the nature of this. We're dealing with a pandemic, something no one's ever dealt with before. And the information that people make decisions in a pandemic is constantly changing. And as I said, our door's open, we read what we get, we talk to people all the time. We have a medical advisory board that's been incredibly valuable to us, and in many cases has put us in a position to make better decisions than people have made in other places. But we'll certainly take a look at the information that's being made available there, and if we think we need to make a change, we will.
Last question.
Governor, a housing question for you and the Secretary of State. WBR recently reported a legal battle over affordable housing in the south end of Boston, and how out-of-state interests are trying to force the sale of the property. Does your administration have a plan to fight this as well as other threats like this in the coming years?
So we've talked pretty much since we took office about the lack of affordable housing and the lack of production here in the Commonwealth. We are the classic example of if you don't build any new housing, you will create a supply problem. And when you create that supply problem, you will create a price problem. We don't have enough affordable housing. We don't have workforce housing. We don't have senior housing. We don't have enough housing of any kind. And after year after year after year of building 30,000 new units of housing for like 50 years in the 1990s, we just stopped building housing for all intents and purposes. And those numbers fell into the, 8,000 units, 9,000 units. And that's where we've been for 30 years. And if you spend 30 years not building a lot of new housing, you create shortages, and those shortages create issues around price, demand, and supply. And, kudos to the legislature. As part of that economic development bill that got passed, we changed some of the exclusionary zoning requirements that have been in place for decades in Massachusetts that have made it really hard for anybody to site, permit, plan, and build housing. We have a lot of dry capital in the bond bill that you folks gave us 2 years ago. There's a bunch of federal money that's available for this. The number one thing we have to do to deal with our housing problem is build more housing. We have to build more housing. There'll be specific examples of all kinds of things that go in the right and the wrong direction around housing. But I can't emphasize enough how important it is that if we want to deal with our housing crisis, and it is a crisis, we have got to build more housing. The particulars of the issue you speak to is a symptom of a much larger problem we have here in Massachusetts, which is we don't build enough housing, which makes whatever housing we have far more expensive than it should be, which makes it very interesting to all sorts of people who are looking to take advantage of the strain on supply. I apologize for the lecture on this one, but I've been talking about this since we took office as a major constraint to people's ability to live here, people's ability to work here, people's ability to grow old here, people's ability to start a family here. This is a huge problem, and if we don't go hard at this, coming out of this reopening and recovery, now that we have some new tools in the toolbox with respect to how to do this, it will be a huge missed opportunity. I mean, I can let Mike speak to the particulars and the specifics on this case, but we have a much bigger issue, and it's we don't have enough supply of any kind. And it's a big problem. It's an equity problem. It's an economic development problem. It's a community development problem. It makes huge differences with respect to where people can actually afford to live here in the Commonwealth, whether or not they can stay, and where they make decisions about where to start a family. So, do you want to talk to the specific on that?
Well, everything the governor said, of course, is true. We have a huge supply-demand problem. This creates it creates distortions in the market, which we're seeing now. That article did catch our eye. We're taking a look at the issue. My understanding is it only impacts a couple of properties in Massachusetts now. It will inform how we make other affordable housing awards going forward to try to build in some more safeguards for that kind of thing. There are potential legislative fixes at the federal and state level, but it's something that caught our attention. But the overall problem, of course, is a supply-demand imbalance, which encourages that kind of activity which we read about.
Should the state be stepping in, though, and protecting the affordable housing that's there?
We should, and we're doing that, yeah, for sure. We have so many partners in this work through DHCD and Mass Housing and CDAC and Mass Housing Partnership, and they all fund these projects. And when issues like that come up, they all kind of sort of rally and try to protect the affordability of that housing. So it's a real focus of ours for sure.
Thanks, everybody.
Thanks, everybody.